Welcome to the Regen Doc Podcast, powered by dynamicathlete.com. I'm your host, Dr. Aneesh Garg. I'm Yale trained, Andrews trained, and a two-sport U.S. national team doctor here to help you make sense of regenerative medicine. Plantar fasciitis, why it keeps coming back. You've done the night splint. You've done the insoles. You've even rolled a frozen water bottle under your foot every night for 6 months. And every time you think it's gone, you take a step out of bed in the morning and it's right back. Here's why. What you're doing is managing the symptom. Nobody is treating the issue. Let's get into it.
I've had plantar fasciitis for over a year. I've tried everything. Why won't it heal?
The gap here is that roughly 10% of the population suffers from plantar fasciitis. Chronic plantar fasciitis is actually a misnomer. The name's not correct. So the itis, right, that everybody associates with inflammation, plantar fasciitis is not an inflammation issue. It's a tissue degradation issue. Same thing in your elbow, right? Like golfer's elbow, tennis elbow, the medial lateral epicondylitis. Some of these things are just, you're learning that these are incorrect ways of calling them things. So plantar fasciitis isn't about inflammation. It's about tissue degradation. So the tissue's now stopped healing. So everything that you've been doing treats this acute on chronic situation. That inflammation is true. But when this keeps happening, 3-6 months, this is actually what they call a fasciosis, like a tendinosis. So the osis part is really more about tissue degradation. So that's the knowledge gap here, is thinking that the inflammation is the only source of the pain when it's actually a tissue degradation problem. So this is a different problem that requires a different treatment. So that's really a big thing. The standard care doesn't make a distinction about this, right? And this is why people suffer for years. I'll go back to the same thing. I'll hammer the same thing. You have pain. You do a little bit of PT. You may get a steroid injection. Oh, you can't. It didn't work. Maybe we'll do a plantar fascial release surgery. There are way better options that you can do from a non-surgical standpoint that you may have never even considered, right? One of the first indications even for focused shockwave was for plantar fasciitis. So to me, that's an absolute starter right there. So I think that's where the gap is here, where people don't know what the true cause of the problem is.
Would a cortisone shot finally fix my plantar fasciitis?
Yeah, I think this is what people get wrong. I'm glad you asked this question. So the answer is no. Please don't get a steroid injection for your plantar fasciitis. Full stop. If you get nothing else out of this episode, do not get a corticosteroid injection for your plantar fasciitis. All you're doing is weakening that tissue. So you're putting yourself at a higher risk for rupturing your plantar fascia. That's the biggest challenge here. And I think that's what people get wrong here. It's the same old paradigm. You ask people that are in their 60s, 70s, 80s, and they're like even 50s and 60s. I mean, you just ask anybody. They think that steroid injections are the answer to their problem. Oh, I'll just get a shot and I'll be good. That's what people have been conditioned to believe. And I think that's a huge problem. And I think that's a systemic problem. We talked about this on other episodes where the reason why it's used so widely is that people know about it. It's cheap. It's easy to do. And there's some minimal relief that sort of gets them out the door and then says, okay, well, at least they're out of our clinic. They feel like they've been taken care of versus actually getting taken care of. So there's a big difference between the two. And I think that's the challenge. So you get a little bit of this short-term relief for long-term damage ramifications. And now you've made the tissue weaker than when you've started. So not only has it not solved the problem, you've actually now made it worse. So then I'm asking, what are we doing? Right? If somebody is proposing a steroid injection for your plantar fasciitis, walk out. Go get a second opinion, because you're going to make it weaker and it's going to be worse for you. I would encourage you to go to dynamicathlete.com and read about the options. Certainly read about why EMTT and focused shockwave and radial pressure wave combination makes a huge difference in this space. This is where I would caution people that are just doing radial pressure waves. Remember, radial is not shockwave, it's radial pressure waves. So don't be fooled by that. And then you're looking at making sure you're targeting it with a focused shockwave machine and not a broad unfocused, because you're really targeting specific tissue in that respect. And how EMTT, the extracorporeal magnetotransduction therapy, which is a mouthful, actually enhances what we're doing and really works on the nerves quite well. So there's a lot that can be done, and certainly looking at this from a different angle. And could PRP, could stem cells be part of that? Could even working on your pelvic floor and core, if you're weak there, are you walking differently? I think that's really it. Is this a nervous system issue where if you can reset the nervous system in a way that helps create a better healing environment, that might be beneficial for you? So I'd encourage you, go to dynamicathlete.com, see the information that's there, and be more informed. But as we've stated in the beginning part of this, the answer to would a cortisone or a corticosteroid or a steroid shot, they're all the same, finally fix my plantar fasciitis? Unequivocally, my feeling is no. And that if you get that answer, I tell you to walk out and go get a second opinion, because that's not the only thing for you.
So what actually works for plantar fasciitis that's been going on for months or years?
Yeah, it's a great question. Shockwave therapy, focused shockwave therapy, is a gold standard for plantar fasciitis, right? Fasciosis, as we said earlier. There's really good evidence, studied evidence, and one of the first indications from an FDA clearance standpoint was for plantar fasciitis. So there's no question that it works. So much so that I would absolutely question the notion of a steroid injection, like I have so strongly in the first part of this pod. And I think that's where understanding what the options are and what are we trying to do here. So I'm in the camp that inflammation's good, but it has to be good inflammation. So your goal is to take out the bad inflammation and then help that injured area with increased blood flow. And that's what, when we use the EMTT and we use the shockwave and the focused shockwave and the radial pressure wave as an adjunct, not as a sole treatment, that's another thing to be mindful of. It works wonders. They do great. And then you start to see, okay, I'm taking care of the tissue. I'm not just masking symptoms. I'm actually taking care of what the problem is. So I think that's really the big thing. And then you look at the course in which, if this has been going on for such a long time, that the focused shockwave and the EMTT and the radial pressure waves can take you to a certain level. But what about that last 10, 15, 20%? And that's where you talk about PRP or stem cells and make a difference in that regard. And then on top of that, we've talked about the other things where, is your pelvic floor and your core contributing to the problem? Is this a nervous system issue? Is this something where you've now created a hyper-stressed state because everybody's dealing with stress and anxiety? And how do you create an environment where that gets decreased so your body can stop being stressed and start healing better? So I think there's a lot of good things that can be done in this regard. And I think this is where you use EMTT and shockwave to almost create a really good environment for the PRP and stem cells in that space.
What does treatment look like for someone who's had this for years?
Yeah, I mean, I think the big thing we go back to, and I'll hammer, is this truly the diagnosis, right? Is this plantar fasciitis, fasciosis? Is this a stress reaction in their heel, their calcaneus? Is this a midfoot sprain? Is this coming from somewhere else, really? So let's clear that first. So that's really the big thing when, from a patient standpoint, understanding what this is. So we try to make sure we rule out a lot of these other things that can cause that type of pain, and we go after it. So let's say it's the true plantar fasciitis where there is, or the fasciosis, that there is that thickening and degradation of that tissue. So this is where the EMTT works on creating a better environment. So what that magnet does is help create a cell structure that nutrients can go in easier and toxins can go out easier of the cell. That's how I explain it to our patients and athletes, that you're trying to create a better healing environment, and then you utilize the focused shockwave to target those injured cells. And so you start to notice a difference. And one of the things that we have them do is actually walk and do something that normally causes them pain. And then we do our work, and then we have them do it again. And you'll see the faces on some of these people as if we just pulled a rabbit out of our hat, or it's some voodoo. And you start to explain why this is working for them. And it starts to make sense for them. And the biggest change that I see is the buy-in. They understand, because a lot of what we try to do is educate and make sure they have a really good understanding, right? I can't tell you how many times that we hear that I went to PT and I go, well, what did they send you to PT for? And they go, I don't know. My doctor just sent me to PT. And then I'm like, what are we doing? And so for us, it's really important that our people have a really good understanding of what they have, what caused it, what are we going to do about it, and what are we going to do if that doesn't work, right? So there's a comprehensive plan in place for them. I think that's the component here, that you start to look at some of these issues, and then you're trying to create a comprehensive plan for them so they know where they are in the process. So I think that's really the big thing. But we've had plenty of patients that have come in. They thought that a steroid shot was their next step, or they were going to get a release, and they've come in, no surgery, no steroid shot, no more night splint. The tissue's finally healing because we're tackling the tissue degradation.
Why don't more doctors recommend Shockwave for plantar fasciitis?
Yeah, that's a great question, because I don't think they know about it. I think they get bombarded with what's real Shockwave and what's not, or they've never even heard of Shockwave, or they don't get taught this in school. This is why we have such a long waiting list for our students from Rocky Vista, in the sense they want to come and rotate us. They're going to see stuff that they won't ever see or don't have access to. And so you start to see what a difference you can make. And now we're shaping younger physicians who are now going to go out into this world and know about these things. And now we're creating more informed physicians that know about non-surgical treatments, that won't send a plantar fascia patient to a surgeon when they know that there are a lot of these non-surgical options. And so, right, so when 90% of these injuries don't actually require surgery, this is the route to go. So I think it's an education challenge with the doctors through no fault of their own from an educational standpoint, unless they're actively searching these out or continuing their education in this regard, right? This is why I was asked to give a grand rounds lecture at Boulder Community Hospital recently, just going over what are these non-surgical options that we're doing that can make a big difference in the community. I think the other thing too is that systemic problem, and the system is broken. insurance doesn't cover it. And in the current system, if insurance doesn't pay, it doesn't exist. And I think that's kind of the mindset. We talk a lot about buying back time. So what's your most valuable resource in this world? It's your time. We have the ability to buy that back. Think about it. If your pain's been going on for months to years and you invest in something that's going to take care of the problem, and we get this resolved somewhere between 3, 6, 12 weeks. Now we've bought back years of pain-free life for you. That's a pretty solid investment if you're buying back time. I think if you're going to be spending money and you're buying back time, that's a pretty smart play. And I think when you put it in that context, you start to understand the impact that you can make with regenerative medicine. And so I think part of this is there's too many people out there that say they do regenerative medicine or say they do Shockwave or say they do this. I mean, we started a training institute, right? If you look up the American Shockwave Training Institute.com, we're actually training people how to use these devices properly. And when you use real patients that have had Shockwave done by us, and then they get it done by these trainees, some of them have been using them for years. And you start to make differences in terms of their technique or how they apply it or their decision making. The patients can feel it. The patients come into our clinic and say, I've had Shockwave done for my plantar fascia. It doesn't work for me. And then they experience what we're doing. They say, I've never felt anything like this before. So how can that be? They've had Shockwave, and then they have Shockwave with us, and they tell us they've never felt anything like this before. So inherently, there's a difference, right? Is it just the radial pressure waves that was used? Was it broad unfocused that was used? Was it something else, right? I mean, like, so there's a whole host of different things. Was it some knockoff version from Amazon? Was it, who knows? But I think understanding who's doing it, what team is doing this, and having a really good idea. And I think that's really the big thing. So the challenge with that comes down to a systemic problem. So now you have doctors that don't know about it. And then you have an insurance world that it doesn't cover it. And I've said this before, that the insurance company doesn't have always your best interest at heart. So if you're looking for insurance covered things, you're going to be missing out on a lot of really good things that can help you heal faster. The price you're going to pay, like you're going to pay one way or another, either in your time or your pain or whatever else, or you pay an investment in your health to try to get back faster and to heal the problem. So it's much like I talk a lot about conflict avoidance with people, that if you try to avoid conflict now, it's going to be worse down the line. So conflict's coming for you either way. It's just, how do you want to deal with it? Head on, or do you want to just delay it, even though you know delaying is going to make it worse? So kind of the same way here. So the pain's coming either way. Either you take care of it now, or it just compounds and it gets worse, and then you got to deal with it later. So you have to deal with it at some point. I'd rather you deal with it earlier, and maybe you don't need PRP. Maybe you don't need stem cells at that point, and you might be able to get treated and healed from other options that may not be as financially costly. So that's what I would look at, is doing that. So the treatment of the issue didn't change. It's sort of reimbursements and the knowledge, right? And so I would ask your doctor about Shockwave, and then do your homework, because not all Shockwave is the same. So don't get fooled by that. For me, the gold standard is focused Shockwave. So really the big things that I want you to take away from this is that if you're having issues for months or years, understand that this is not an actual inflammation issue. This is a tissue degradation problem. And this is why anti-inflammatory treatments like steroid injections aren't going to work. They're actually going to make it worse. Focus Shockwave has very good evidence that works, and especially when you enhance it with EMTT and radial pressure waves. Remember, radial pressure waves is not true shockwave, and then that can make a big difference for you in that regard. And then if you've been dealing with this pain for months, I would really encourage you to go on dynamicathlete.com and read about the different options that are there and see from a non-surgical, non-steroid injection standpoint that can make a big difference for you in that regard. So if you have any questions, all the information on dynamicathlete.com should be able to answer them. And certainly, if not, shoot us a message, but that should get you well on your way, and we'll see you next time.